About this Congress, what are the most interesting presentations for you?
Well, we had some very interesting presentations, and that's a little bit outside of the field of OAB, but we had a discussion this morning about the treatment of BPH and the role of new lasers and the role of new medications and how we have to treat patients with bladder outlet obstruction at this moment. PDE5 inhibitors, anticholinergics, combination of drugs, alpha blockers, or should we operate? And I think that this was very interesting for the general urologist because the talks that were given were very critical and gave a very good overview of the current knowledge of the field. And actually, when we talked about surgical treatment, because it's not only medication, of course, also there it was interesting to see that an open prostatectomy for benign prostatic hyperplasia is still a very valid option and is still a gold standard. It's becoming a more and more old standard because lasers are taking over gradually, but they still have a way to go. And I think that this was really an interesting overview on the current status. Same goes for female urology, where we are now discussing the complication management of all the measures that we have been putting in over the last few years. Complication management in that field becomes an area of itself, and so we had a very interesting session with hands-on tips and tricks on how to deal with these patients. I think that this is now the focus of this year. Regarding medication, regarding other things, except for the long-term studies that are now appearing, there was not really anything brand new or excitingly new, but just offering more ground to the existing treatments. That is what is happening this year.
Okay, thank you very much. Nice Congress to you.